Hello, very good evening, everyone. My name is Payal, and I welcome you all to We Talk to You, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute. Human Biologicals Institute is a division of Indian Immunologicals Limited (IIL), which was established by the National Dairy Development Board in the year 1982 as its unit and later registered as a company in the year 1999. HBI was established in the year 1998 when Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine. The first manufacturing facility of HBI was established at Ooty. The facility is one of its kind in India to have rolled out first Vero cell culture rabies vaccine in the year 2000. Subsequently, Human Biologicals Institute launched other vaccines, and currently we are the major player in human vaccines. We're leader in anti-rabies vaccine segment and present in around 60 countries. With three state-of-the-art manufacturing facilities at Ooty, Gachibowli, and Karkapatla, HBI has forayed into the market of clinically proven wellness products and infertility range of hormones. Our vision is to shape the global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. We believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. As a market leader, we feel very proud to share about our green initiative, where we have taken a significant step to reduce the plastic burden by 160 tons per annum by introducing eco-friendly pack of our flagship brands. As an organization, we take our corporate social responsibility very seriously. Either it's adoption of government schools where IIL is providing help in midday meal program, or in an association with NDDB through our gift meal program, hundreds of school-going children are benefited. IIL has recently donated an oxygen generation plant to TIMS. For more information, you can also log on to www.indomin.com. Well, I'm sure many of us would know that PCOD or PCOS is a very common condition these days, which is affecting many women out there. It affects their reproductive organs, and also it impacts the production of essential hormones that impairs the regulation of menstrual cycle and all other complications. So to understand more about this topic, we have a very special guest with us today. Please welcome Dr. Jyothi Malhotra from Patna. She is a celebrated gynecologist and infertility specialist. She has helped many ladies to combat and deal with PCOS. And it's a pleasure to have Dr. Jyothi with us.
Thank
Most
you.
welcome.
Thank you so much, Payal. Thank you so much. And a very good evening to all the audience who are present here today. And PCOD, should I start straight away, Payal? Yes, just an introduction. Yeah, just introducing the term polycystic ovarian disease. Previously, it was known as PCOS, but nowadays it's like a disease more rather than a syndrome. So the thing is, this is a problem which is seen more and more, especially in Indian population. And the reason is that it is not only genetic, but mainly it is environmental. So basically, the lifestyle changes which the females they are undergoing nowadays. Lot of burgers and pizzas and fried foods and fast food. So all these lead to obesity, increased in BMI, and as a result, what happens is that there is hormonal disbalance is there, which should not be actually, but it happens because of all these lifestyle modifications. And as a result, this problem of PCOD crops up. And moreover, it has got little bit of genetic factor also to it. and adding to it is the environmental factor. So both these combined, and there are lots and lots of cases of PCOD which are coming up, and many girls come with these problems. And it is actually a multi system problem. Later on, if it is not treated, it can lead to even heart problems, even diabetes, what we also called as metabolic syndrome. That is the thing, what it is. So it needs to be treated, definitely. No way. So now, should I go on, or you want to know something specific?
Thank you so much.
Thank you so much.
So we would also like
We
to
would
know
also like to know if there are any certain symptoms
and signs
that a lady should know if she is suffering from PCOS. I think that would really help us know more about.
So actually, the thing is that usually the young girls, if they are having menarche, but sometimes after menarche means the date or the year or the time at which the periods start. So now, if immediately after menarche, the periods are usually deranged type. Sometimes they come regularly, sometimes they don't. So this can go on for 2 years, max 2.5 to 3 years. But if this derangement of prolonged periods or heavy periods or whatever, the periods are not regular after menarche for more than 2 to 3 years, always we should suspect. And of course, the girl is a little bit overweight, then we have to suspect this problem of PCOD. And then she should go and consult a doctor for a deranged or prolonged periods, because if they come very early, then we always tell them that कोई बात नहीं है, अभी तो शुरुआत है, just see, observe, अभी तो 14 साल 15 साल की लड़की है, ठीक हो जाएगा. But if this persists, then definitely no way, you have to come early, take the treatment early. Because what happens is this, that in PCOD, the usual symptoms are, one is menstrual problems. Like I told, the periods delayed ho jate hain. Sometimes they can come early, but usually delayed, because ovulation does not occur. Every month, if you are having periods, then the thing is that every month she is ovulating. But if the periods are, they are skipping, and 1 month she is not having, or 2 months she is not having, that means those times she is not ovulating. So there is problem of anovulation, and these problems can later on lead to endometrial hyperplasia. This is a condition in which the endometrium, which is the lining of the uterus, it becomes thickened, and this can cause problems later on. So this has to be taken. Another important symptom is sometimes patients come with, they have got breast problems, huge breast, bust is enlarged. Then they can come with acne. Acne are there. Then young girls, adolescent girls, they are coming. नहीं जा रहा है, बहुत treatment किया नहीं जा रहा है. Then acne is there. Another is hirsutism, that is facial hair, or maybe hair other places also, like back, like shoulders, abnormal places if hair growth is there. So this is abnormal hair growth, which is not usual for a girl to have. So this is, male pattern of hair. Then also, this is like over up above the upper lips and all, beard area may, if she's having hair. So this is again a problem related to PCOD. So these are the symptoms. And signs, yes, of course, it is so much frustrating for the any girl to have all these problems. So naturally, they are worried that why is this happening? Why is it not going? The mothers are worried. So these are some of the frequent signs and symptoms in the early stages. Later on, of course, lots of problems, like I told you, diabetes and heart later on, if it's not treated. So these are the common. And then again, if she's, married and all, then she can come with that I'm very overweight and I'm not conceiving. So infertility also may be one of the symptoms in a slightly 20-25 age groups. There is actually no age limit at which we can detect. It can be detected as early as 12, 13, 14 years, or maybe even 20-25 years. And one thing important, that there is no cure. There is absolutely no cure. But the thing is, we can treat and we can prevent it. We can just, हम उस time पे रोक सकते हैं. But whatever has been done is done. So the thing is, all progression नहीं होना चाहिए. So let us stop it there and then as you diagnose.
So what do you mean to
So what do you mean to say? It cannot be cured permanently.
It cannot be. It is a lifestyle thing, so it has to be. So as long as you are having proper lifestyle, you are taking your medicines, you are okay, then the hormones will be produced in a normal way and you will be normal. But as soon as something goes haywire, then it can come back.
Right.
Right.
That brings us
That
to our
brings us
next
to our
question.
next question.
Talking about certain types of food. What kind of
What
lifestyle
kind of lifestyle
remedies you
remedies
suggest
do you
for our
suggest for
audience
our audience
See, like
to follow?
basically we tell them, like any girl, they usually girls come up in 12th class, in young college girls, they come up with acne, and then they come up with overweight, and then they come up with period problems. So I just tell them, see, you have to do only two things. Medicines को भूल जाओ, बस दो important चीजें याद रखना है. One is diet and another is exercise. Nowadays सब उल्टा हो रहा है. They're eating more, exercising less. It has to be more exercise and eat less. So the balance has to be other way around. So I tell them, you have to do exercise, you run, you skip, you play badminton, you play whatever you want, but you have to exercise. Another thing, your calorie intake should be really, really decreased. So low carbs, it should be high proteins, low carbs, low fat diet should be there, and no fries and what, all this pizza and burgers and I don't know what all they eat. So sometimes it's okay, cheat days, but otherwise, no, no means no. So, and when you do these in 6 months' time, the symptoms automatically, become normal. And even if they don't become normal, then of course we can add on the medicines. So the medicines, yes, there are medicines. There are simple medicines. Hormones are there. These are oral contraceptive pills are there. They are low dose pills we usually give for the young girls, not high doses, and they have to be given for 3 to 6 months depending upon the symptom. So if it's mainly a menstrual problem, then we give us one type of oral contraceptive pill. But if it is mainly acne and all or hair growth, then we give cyproterone acetate wala pill dete hai. If it is acne, even drospadanon wala pill bhi, it helps quite a bit. So, but these have to be taken for at least 5 6 months. And along with this, diet and exercise is the gold standard. So this is there.
Thank you.
Thank you. Thank you so much
For
for
helping
helping us know
many
many
important insights
important
about
insights
the
about
field. Yes,
the
I'm
Else,
sure
I'm sure
people
people
watching
will be
this
watching this
get a lot of
get a
insights.
lot of insights.
Hopefully,
So
yes.
So I will try to
identify one
identify
very
one
common
very
question that
common
we
question
have.
that we have.
In many
Many
stages, we have
stages
this
we have
thought
this
that
thought
if
that
we are suffering
if we
from
are suffering from
PCOS,
PCOS,
getting
getting
pregnant is
pregnant is
it's a difficult
it's a difficult thing.
and
And
many
many
misconceptions that
that
they can't
they
get
can't
pregnant
get
because of
pregnant because of
PCOS. So what is
So
your
what is your
what are
what
things that
there
you
are
want
things
to
that you
highlight?
want to highlight?
See, the thing is this, because PCOD women, they have got difficulty in ovulating. But yes, what we suggest is that one thing is down regulation. So we give them hormones. These oral contraceptive pills. These are actually, preventing conception. So, but the treatment is that first you prevent conception, give them these hormones. As a result of these hormones, their ovulation will be triggered. And once you give them for at least 3 4 5 months, so as to suppress their, these male hormones. So because in these patients, what is seen is that LH is increased, and even the androgen, the testosterone, which are the male hormones, these are slightly increased. So because of these oral contraceptive pills, these hormones are suppressed and the ovulation returns back to normal. So once the ovulation returns back to normal, then they can go in for ovulation induction, or even they can stay together and they can try for a normal conception. So there are many, many, many ladies who have become pregnant. So it's not a big taboo, and it's very, like, just a little bit of willpower and controlling your weight and exercising, and a little bit of doctors, feel good messages, and then I think the trick is there.
Thank you so much,
Thank you
Dr.
so much,
Jyothi,
Dr. Jyothi,
for your
for
time
your
and
time
giving
and
us such
giving us
wonderful
such wonderful
insights
insights
Thank you so much.
about
about PCOD. I'm sure
PCOD. I'm sure
all the ladies
all
that
the
will be
ladies that will
listening
be
and
listening
watching
and
this
watching
video
this
will
video in
really
future will really
get a lot of
get a lot of
information.
And one last thing, like Payal, I just wanted to stress that you have to, like, the diagnosis is very important. So there are many other diseases and problems which mimic like PCOD. So even if you are suspecting, please don't Google. Please come to the doctor. There are specific blood tests There are scans which have to be done, and you have to confirm first that it is really PCO and nothing else, and then only you can stay back and do diet and exercise and whatever. So you have to consult a doctor for any of your symptoms. Don't Google. Don't be overconfident. So that is what I want to stress actually.
Very rightly
Very
said, ma'am.
rightly said, ma'am. Thank you
For
so much
stressing
for
upon that
stressing upon
point.
that point.
Thank you
Thank you
so
so
much.
much.
And
And I
I
also
also
would
would
like
like
to
to
thank
thank
all the
you
viewers
who
who
joined
joined
us
us online today
and who will be
and
watching
who
this
will be
video.
watching this video.
Yeah.
Anyone please
Anyone
do share it
please
with
do
them.
share it with them.
And if you want us
If
to
you want us to do
with
with
such topic in
such
future,
topic
please
in
write
future,
to
please
us
do
at
write to us on
www.puberty.com.
www.puberty.com.
With this,
With
I
this,
thank you
I
all
thank
once
you
again.
all once again. Thank you so much, Dr.
For
Prabhu,
joining us.
for joining us.
Thank you so much.
Thank you, and I wish you all
Thank
a
you,
very good
and I wish
evening.
you
Thank you
all a
so
very
much.
good day. Thank you so much.
Thank you. Bye bye.
Bye.
Bye.